this is left untreated, postpartum psychosis then becomes a problem.
That is the worst case scenario, and that is when you feel like you could harm yourself, your baby. You have hallucinations, delusions, you're hearing things, you're hearing voices. This is the worst case scenario, and unfortunately, this happens in every one out of 1,000 births. It is a serious disorder, and psychosis is something that you need to seek immediate medical attention. 911, family needs to go, because ultimately psychosis a lot of times leads to the mother hurting herself or her baby.
When the two of you are dealing with moms, and when you're dealing with women who have gone through pregnancy, and we're talking about this, the PPS, right, or the postpartum psychosis here.
Right.
You've obviously had experiences before where you've seen it.
Yes.
I mean, can you tell us what it was like to experience that, and what it was like to watch that? Because that has to be traumatic to see a woman go through that.
You know, speaking briefly on it, I you know, obviously for confidential reasons, I can't go.
Please, yes, we're not. I'm just talking about very generic ideas here.
You know, it was hard. I did witness somebody that did go through postpartum psychosis, and I was actually kind of close with her, and it was hard to watch her feel helpless and just feel like her entire world was spiraling out of control. And unfortunately, the outcome in that situation was not the best. And it was horrible.
It was a grave situation.
It was very hard to see.
She was a patient that, you know, we had become close to.
Right.
And she visited us often, and the outcome was not as, she didn't get the help that she needed immediately.